Welcome to our exploration of joint flexibility and the biomechanics behind it. In this video, we'll break down the science of how our joints move, the sensory receptors that influence flexibility, and the various stretching techniques used to increase or maintain joint range of motion. Whether you're an athlete, a student of biomechanics, or simply interested in improving your mobility, understanding these concepts can help you make informed decisions about your stretching routine. Let's start by looking at why joint flexibility matters and how it impacts our daily lives and physical performance. Understand joint flexibility, we need to look at the sensory receptors that play a crucial role in muscle extensibility. Two main types are involved: Golgi tendon organs and muscle spindles. These receptors are embedded within our muscles and tendons, constantly monitoring changes in tension and length. Their responses help protect our muscles from injury and regulate how far we can stretch. By influencing muscle contraction and relaxation, they set the foundation for safe and effective stretching techniques. Golgi tendon organs are specialized sensory receptors located within tendons, near the muscle-tendon junction. Their primary function is to monitor and respond to increases in muscle tension. When tension rises, these organs inhibit further tension development in the stretch muscle and initiate tension in the antagonist muscles. This response helps prevent muscle damage by promoting relaxation in the muscle that's under stress. Understanding this mechanism is key to appreciating how certain stretching techniques work. Muscle spindles are another type of sensory receptor, but they are found interspersed among muscle fibers running parallel to them. Their job is to detect changes in muscle length. When a muscle is stretched, muscle spindles provoke a reflex contraction in that muscle and inhibit tension in the antagonist muscles. This reflex helps protect the muscle from overstretching and injury, but it can also limit flexibility if not managed properly during stretching exercises. Let's compare Golgi tendon organs and muscle spindles side by side. Golgi tendon organs respond to increased muscle tension and promote relaxation in the muscle developing tension. In contrast, muscle spindles react to increased muscle length, causing the muscle to contract and resist further stretching. Together, these receptors balance muscle protection and flexibility, ensuring our movements are both safe and effective. Stretching can be categorized as either active or passive. Active stretching involves the active development of tension in the antagonist muscles to stretch a target muscle. For example, when you contract your quadriceps to stretch your hamstrings, that's active stretching. Passive stretching, on the other hand, uses an external force, like gravity, a partner, or equipment to stretch the muscle without active contraction of the antagonist. Both methods have their place in flexibility training, and understanding the difference helps you choose the right approach for your goals. Ballistic stretching is characterized by a series of quick, bouncing-type movements that push the muscle beyond its normal range of motion. While this method can increase flexibility, it also carries a higher risk of injury due to the rapid, uncontrolled nature of the movements. Ballistic stretching is generally not recommended for beginners or those with joint issues, but it may be used by athletes under professional supervision for specific training purposes. Static stretching involves holding a slow, controlled, and sustained stretch for a period of time, usually around 30 seconds. This method is widely considered safe and effective for increasing flexibility and is often used in cool-down routines after exercise. By holding the stretch, you allow the muscle to gradually lengthen and adapt, reducing the risk of injury and improving overall joint mobility. Dynamic stretching involves moving parts of your body through a full range of motion in a controlled manner without bouncing. Unlike ballistic stretching, dynamic stretches are smooth and deliberate, making them ideal for warming up before physical activity. This technique helps increase blood flow, improve mobility, and prepare the muscles and joints for more intense movements. Passive static stretching is a specific form of static stretching where you hold a position at the extreme end of your range of motion, often with the help of an external force. This could be gravity, a partner, or a piece of equipment. The key is to relax the muscle being stretched and let the external force do the work. This method is effective for increasing flexibility but should be performed carefully to avoid overstretching. Proprioceptive neuromuscular facilitation, or PNF, is a group of advanced stretching techniques that involve alternating contraction and relaxation of the muscles being stretched. PNF is highly effective for increasing flexibility and is often used in rehabilitation and athletic training. The process typically requires a partner or clinician to assist, making it more complex than other stretching methods, but also potentially more rewarding in terms of flexibility gain. One of the defining features of PNF stretching is the need for a partner or clinician to assist with the process. The partner helps provide resistance during muscle contractions and supports the limb during relaxation phases. This teamwork allows for deeper stretches and more effective flexibility improvements. However, it's important that both participants understand the technique to ensure safety and maximize benefit. Stretching technique offers unique advantages. Static stretching is safe and easy to perform, making it suitable for most people. Dynamic stretching is excellent for warming up and improving mobility before activity. PNF stretching provides significant flexibility gains, especially for athletes and those recovering from injury. Understanding these benefits helps you choose the right method for your needs and goals. While stretching is generally beneficial, each technique also has potential drawbacks. Ballistic stretching can increase injury risk due to its rapid movements. Static stretching, if done improperly or held too long, may lead to overstretching. PNF stretching requires a knowledgeable partner and can be intense, making it less accessible for beginners. Being aware of these risks allows you to stretch safely and effectively. Summary: joint flexibility is influenced by sensory receptors like Golgi tendon organs and muscle spindles, and can be improved through various stretching techniques. Choosing the right method depends on your goals, experience, and physical condition. Remember to warm up before stretching, use proper technique, and listen to your body to avoid injury. With consistent practice, you can safely enhance your flexibility and support your overall joint health.